Welcome, everybody. We are joined today by 3 Ascension care providers, and we are talking about a ton of topics when it comes to women's health. We have a lot to cover today, so let's jump right in.
Having us today. My name is Emily Lombard. I work for Ascension. I'm an Ascension care provider. I joined the group here about a year and a half ago. I was down in Chicago for about 15 years prior to that. I very much have enjoyed my time here in Milwaukee, and I spend about half of my days at our Prospect location, directly across from St. Mary's, and half our days at our new Third Ward location, which I very much have enjoyed being at thus far.
Hi, my name is Dr. Nipun Verma. I'm also new to the group here, been here for a little over a year. I have a special interest in gynecologic surgery, specifically robotic surgery. And I also see patients at our Prospect Medical Commons as well as our new Third Ward location.
Yeah. Hi, I'm Izzy Nellen. I've been with the group really the same amount of time as Dr. Lombard and Dr. Verma, about a year now. I go to our Third Ward location, our Shorewood location, and our Prospect Medical Commons location. I also have a special interest just in prenatal care and also high-risk obstetrics. And then also I really enjoy gynecology and GYN surgery.
Dr. Lombard, we're going to start with you. So one of the things that I notice when I'm looking at the list of care providers that are available at a clinic, or even just now on this screen, I noticed that 2 of you have a DO after your name and not an MD. And that's not something I was familiar with until right now. I was this many years old. So can you tell us, what does that mean? What does the DO mean, and what role does that play in women's healthcare?
Sure. So a DO is a doctor of osteopathic medicine. It's a little bit different than a medical doctor. In the United States, we all get credentialed the exact same. We all have the exact same privileges at hospitals. So we do the exact same thing with myself or any of my partners that you do see in the office. One of the things that we learn a little bit different in our schooling is we have a hands-on medicine portion that we learn. We're very much taught that the body is a unit, which is similar to a medical doctor, an MD itself. But with that training, I think we learn a little bit of a more holistic approach. So sometimes we can focus on some of the non-medical treatments, non-medicine sort of things. I do have many patients that seek me out purely because I am a DO. I think with obstetrics, it's great because we have the musculoskeletal training that sometimes we can, tackle back pain, pelvic pressure, all of the things that we all know that occur with pregnancy, where we can work with our physical therapist. But even in the office, there's quite a few things that I can do and teach patients to help with stretches at home, things like that. I think after pregnancy, with some of the incontinence and prolapse and things that happen, our musculoskeletal training as well. We have different maybe tools in our bag that can help patients with Kegels and things like that we have a little bit more of a guided training. The rest of the training is exactly the same as a medical doctor. So many patients who come in might not see a whole lot of difference between the 2 of us, which is great. So I don't want patients to think, that they're getting any better or worse care from anybody that we see in our group. It might just be a little bit different approach to some of the disease processes that we're seeing.
Part of one of the things that you work with your patients on is breast care and screenings and things like that. And as we go into the month of October, obviously that's Breast Cancer Awareness Month. So
just to know us from the American College of OBGYNs, we recommend screening starting at 40 years old if no strong family history. I think one of the things we need to make sure we're speaking to providers about is if we do have something abnormal with our family history, somebody who's been affected. Oftentimes the screening mammogram even happens before 40, which I think many 30-year-olds never even think about. We have a great mammography suite over at the Women's Hospital over at Columbia St. Mary's. I've had 2 mammograms there myself. It's been a very pleasant experience. So make sure that if you haven't gotten your mammogram by the time you're 40, typically that's when we start. It's every 1 to 2 years. I do have patients that are a little hesitant to go. If you're in your 50s and still haven't had one by then, for sure, we need to make sure that you're getting your yearly screening done.
Dr. Nellen, let's move on to you. So you mentioned that you are seeing patients in the new Third Ward clinic. I know that there's some new stuff, there's some exciting stuff about that clinic. Can you tell us a little about it?
I think we tried to think about everything to try to make the experience as patient friendly as possible. So there's valet parking when you get there. Obviously knowing that we're in the Third Ward and sometimes that can be tricky. So we have that taken care of. We have a lab there so that when you need labs, if you're pregnant or going there for an operative consultation, that you can get those labs done. Something else that I know a lot of my patients, my OB patients have loved being there is that our perinatal sonographers and maternal fetal medicine doctors are there 1 to 2 times a week doing ultrasounds, whether it's anatomy scans or growth ultrasounds in the pregnancy where we need to kind of check in on baby. They're there on site and can just go to their clinic location to get that high quality care from them. So that's been excellent. It's also a pretty awesome building. It's the old firehouse in the Third Ward.
Oh, cool.
Yeah.
You deliver at Columbia St. Mary's, correct?
Yeah. Mm-hmm.
Okay. And we've been hearing from moms that they are loving those delivery suites. Tell us more about those.
They're really nice. They have labor tubs in each delivery room, and then a walk-in shower. And then there was a lot of thought, it seems like, put into making it just a calming environment, which is exactly what you want when you're in labor and eventually going through that delivery process.
Dr. Verma, we're going to pop over to you. Just rewinding on the calendar a smidge. So September, that was polycystic ovarian syndrome awareness month, PCOS. Can you tell us a little bit more about what is it? And for those who have PCOS, how is that managed and how does that affect, everything from fertility to your daily lives?
Right, yes. So PCOS is a gynecologic disorder that we see and treat pretty commonly in our practice. As you mentioned, there's a lot of different things that go into PCOS. There's a lot of different ways that it sort of manifests. What we commonly see are things like irregular menstrual periods, infertility or a hard time getting pregnant, obesity, as well as difficulty losing extra weight, excess hair growth, especially on the face, so unwanted facial hair, and severe acne on, face and back and other parts of the body as well. If we were to get an ultrasound of the ovaries, we would see this polycystic appearance to the ovaries, meaning lots of small cysts on the ovaries that which are just like small fluid-filled sacs. So, we see women with irregular periods often, and they may not have PCOS, but that's a common reason that patients come to see us, is that they're not having regular periods. And so part of the workup includes a workup for PCOS or polycystic ovarian syndrome. For some women, they may not really notice or be bothered by some of those symptoms until they are trying to get pregnant and start a family, and they see that they're having a hard time with that.
And what can be done for PCOS patients in terms of fertility? If they're one of the things that keeps coming up is there's a struggle to sometimes conceive with PCOS.
And so usually the underlying issue with PCOS when it comes to fertility is usually difficulty with ovulating. So your ovaries are not ovulating each month in kind of this nice cyclic manner. And so what we can do is work on improving your menstrual cycles, regulating those menstrual cycles, again, with diet, exercise, and medication. And then sometimes we also can use medications that induce ovulation. So we have a couple of different medications that we can use that can help to cause a woman to ovulate so that we can kind of line up that timing and help them get pregnant.
So thank you for all of you for all that you do in helping to keep your patients as healthy as possible, and especially in excessively difficult times that we are still in. So, and folks, if you are interested in learning more about these clinics, about these particular care providers, you can go to ascension.com/MKEmom and get started, and you can find out even more about all three of these lovely, lovely people, and schedule an appointment for yourself or somebody in your family. So thank you so much to all three of you for taking the time today, and we appreciate it very, very much.